People can be in various states of what we call end-stage liver disease. You can have cirrhosis and from a number of causes, and your liver disease is relatively stable. And how we determine how quickly a transplant is needed is how severe your medical condition deteriorates to. And some of that is determined by declining health, or about 30% nationally of all transplants are done are for what's called hepatocellular carcinoma. And that can be caused by a number of reasons. It can be caused by viral illnesses, Hep B, Hep C, not active alcohol drinking, but people who've drank in the past and have stopped and they develop cirrhosis can develop hepatocellular carcinoma. The largest group of people coming to the forefront now for transplant are people with what we call NASH, or non-alcoholic steatohepatitis, essentially a fatty liver. They can develop liver cancer. So a number of different we call disease etiologies can develop cancer. Most of those people, though, however, are relatively healthy, but they just have a cancer. And there's a national pathway by which we give those people a score higher so that we transplant them quicker.
We rank people by the list by a score called a MELD score. And MELD is an acronym for Model of End-Stage Liver Disease. And it's a composite formula of 4 different blood tests with different weightings fitted into a formula, and then we get a number. And MELD scores range from 6 to 40 generally, 6 being, well, they all have cirrhosis, so they have some liver disease, but very well compensated cirrhosis, and 40 being not doing so well. So we in other transplant programs usually work patients up when MELD scores get up to around 15, and patients in our part of the country usually get transplanted when MELD scores are around 25 to 30. And in different parts of the country, there's different scores at which patients get called for transplant.
The converse of that is you're doing fine, you go to work, you wake up, you have this GI illness, you've developed a virus, and the virus puts you in liver failure and you need a transplant in the next week or the next 48, 72 hours. So those people get higher priority for transplant. And again, I mentioned that organs, I didn't say it this way, but organs don't grow on trees. So, there's a scramble, a search to make sure the patient is healthy enough for transplant and that we can list them, and then the search is on to try and find a healthy enough organ to transplant them to get them through the illness. We run rates higher than the national average here, and the national average at 1 year is about 91%, and I think we're doing about 93% survival 1 year. Our 3-year survival rates are also excellent. They're above national average. So I think we do a fantastic job here.